Durations Matter, a discussion with the APS TARC. Next slide, please. Before we get started, I want to go over a few things. NAMRS and the APS TARC are a project of the U.S. Administration for Community Living, Administration on Aging, Department of Health and Human Services, and administered by WRMA Incorporated. Contractors' findings, conclusions, and points of view do not necessarily represent the official policy of the U.S. Administration for Community Living, Administration on Aging, Department of Health and Human Services. The models and information provided during this presentation do not serve as official guidance to comply with any part of the APS Final Rule. All information provided is done so for informational purposes only. Next slide, please. This presentation is being hosted by the APS TARC. We work with states to enhance the effectiveness of APS programs by supporting our partners' use of data and analytics, applying research and evaluation to practice, encouraging the use of innovative practices and strategies, and providing APS programs with individualized technical assistance. We're here to help APS programs in any way that we can. Just reach out to us using the contact information that will be displayed at the end of this presentation. Next slide, please. Our agenda for today includes an overview of what case durations are and how they are determined, a review of the soon-to-be-released APS TARC brief on case durations, including the findings from an analysis of case duration data from NAMRS, and a peer discussion on what we think the findings mean. The objectives for writing the brief and holding this discussion about it are to increase understanding of why durations are important and how they impact APS casework practice. Today's presentation is being recorded without a live audience. Should you have any questions after viewing this recording, please reach out to the APS TARC team using the contact information provided at the end of the presentation, and we will be happy to discuss your questions with you. Next slide, please. Joining me in presenting this information today are Carl Urban and Gila Schusterman. We are all members of the APS TARC team, along with Andy Capehart, Jennifer Kirchen, and Michelle Gayette, who will also be participating in the discussion a little bit later. Next slide, please. The APS Final Rule highlights the importance of durations in APS casework, specifically including requirements, and I am paraphrasing here, for a two-tiered, risk-based response system for initial contact, as well as requirements for criteria that establish timeframes for ongoing review of open cases and the length of time for completing investigations and making findings. In working on the brief, the APS TARC team offered several ideas on how durations impact practice, policy, and client outcomes based on our experiences working in APS at both the direct service and administrative levels. As Gila and Carl will discuss, many of these ideas were supported by the analysis of the data. The APS Workload Toolkit, a product of the APS TARC's workload study, provides metrics to assist in monitoring timeliness, including durations, to help programs successfully manage workload. Case initiation time may be important in removing the source of maltreatment and increasing client safety. As a government entity, APS should only be involved in the life of a client for as long as intervention is needed. Quicker resolution of a case helps protect clients from long-term injury, or in cases of financial exploitation, greater financial loss. And finally, as we all know, APS programs need to utilize limited resources as efficiently as possible. The most important idea on which there was complete consensus from our team is that timeliness should not be the most important consideration and should not outweigh other aspects of APS casework. Next slide, please. NAMRS collects data in the form of dates on when specific case activities occur. This data is used to determine how much time is spent on these activities. The report date, start date, disposition date, and case closure date are all recorded in the case record and submitted to NAMRS. The APS TARC team uses these data points to calculate 4 key case durations: how long it takes to initiate a case, how long it takes to complete the investigation, how long a case is open, and when applicable, how long a case is open for post-investigation services. A discussion of these time frames is included each year in the Adult Maltreatment Report. For the brief, we went a step further to look at why this information matters. Next slide, please. This graphic is an illustration of the information on the previous slide. The black boxes are the date data collected through NAMRS. The purple arrows, which illustrate the different duration timeframes, are placed between the dates that are used to calculate them. For example, the case initiation duration is calculated by looking at the time between the report date and the investigation start date, as stated in the previous slide. Next slide, please. NAMRS uses rules to ensure that the dates being submitted for the case activities make sense, for lack of a better term. The system will flag dates and produce an error message when the data does not meet these rules, which helps with data quality. The bulleted list on the right shows the rules or criteria that the data must meet to be accepted in the NAMRS submission. Obviously, it would not make sense to have an investigation begin prior to the date the report is received, or for a case to close prior to the start of an investigation. Next slide, please. Now I'd like to turn this over to my colleague, Gila Schusterman, so we can begin discussing the discussion of data analysis.
Okay, hello. So to talk about the analyses that we conducted for this research, you could go to the next slide, please. We used data from a couple different sources. We used to calculate the case durations that we talked about, that we'll be talking about. We used data from the 2023 NAMRS report. So we were only able to use states that reported case component data for 2023. We had 36 states that submitted case component data that year. One of those states did not submit enough of the data for the dates that were necessary to calculate the timeframes, so we had to exclude that state from our analyses. So we had 35 states that we were able to include for the duration data. And then we had the analyses for the policy and practice data. The variables came from the National APS process evaluation. Those data were conducted initially during the spring of 2021. So you can go to the next slide, please. We conducted several types of analyses. We conducted descriptive analyses of each time frame, and Carl, in a few minutes, will be showing the range for each one from lowest to highest and the number of days. Then we looked at how each time frame differed based on the characteristics of the case. For example, the age of the client, the type of maltreatment. We looked at different reasons for case closure and how cases with different case closure reasons had different case durations, and also dispositions, such as was the report substantiated or unsubstantiated. And then we also looked at each of the time frames with the different policy and practice variables. So we compared the timeframes for groups of states that shared certain administrative characteristics, policies, and practices. Then, to determine whether the differences between these groups were meaningful, we calculated the effect size for the differences, and we focused on differences with moderate or large effect sizes. Next slide. We did, in the process of doing these analyses, discover some anomalies in the data that we had to do some data cleaning for. Even though, as Leslie talked about, there are rules, there are validation rules in the NAMRS system that prevent reports from being entered where, like, for example, you have a report date later than an investigation start date, but there aren't rules about the range of the dates. So we actually so for reports that are included in the 2023 NAMRS data, these are reports that reached a disposition between October 1st, 2022 and September 30th of 2023. The report dates, though, for those, we discovered some of them went back as far back as 1939, which we realized really probably is just a data entry error, because that would mean there would be a case initiation time for some of these of more than 83 years, which obviously that's not right. So, and we found investigation start dates going back to 1900. So we had to do some data cleaning to get those dates out of there. So that was something that we had to do. Next slide, please. So we excluded report dates and investigation start dates that were earlier than October 1st, 2021. So that would be like a year earlier than the dispositions that would be included in this file. And then we also excluded records with outlier durations, and that we calculated as more than 3 standard deviations above the mean for each of the durations. And we needed to do that because we were analyzing the averages of groups of states together. We were really trying to have results that were meaningful. And if there's just like one record with an extremely long time frame in one of those groups, that's just really skewing all of the averages, then it won't, we're not going to get the actual information that we're looking for. So we did decide to exclude those outliers. So what we excluded was for case initiation duration, we calculated based on that 3 standard deviations above the mean. We excluded case initiation durations longer than 22 days. And that's just really was a tiny fraction of records. And for investigation duration, we excluded longer than 269 days, that's about 9 months. And full case duration longer than 299 days, which is about 10 months. And post-investigation duration longer than 126 days, which is a little over 4 months. Next slide. Okay, so Carl is going to talk about some of our findings.
Hello. So I am going to run through the findings from our analysis and facilitate the discussion at the end of review of the findings. And so, one thing to point out about the findings is that in the time we have for this webinar, we are not going to be able to cover all of the data that we uncovered through the process. Instead, we're going to try to look at the things that we thought were meaningful. So we're going to define meaningful in a couple of different ways. One is if it had the medium or large effect sizes that Gila talked about, and then even not all of the relationships that came out as meaningful, but we were going to pick the ones that we thought were interesting to highlight and then to discuss at the end. As we go through this, I think one thing I would point out that you pay attention to, because I will not necessarily always point it out as we're looking at these graphs, is the size of the sample. Effect size as a statistic is supposed to take that into account, but nonetheless, sometimes these relationships are based on only a few programs, and so just pay attention to that. And so as we go through it, always what we want to be thinking about is this is very interesting in and of itself. What does it mean? I'm not sure always, but that's how we're going to have the discussion at the end to try to delve into some of that. And so with that kind of little intro, let's get going and go to the next slide, please. And so this is the first of the descriptive statistics that we talked about. We're going to go through these in order. We're going to go case initiation, investigation, post-disposition time frame, and then look at overall case durations. And you'll see some themes develop as we go through these slides. But since this is the first one, let me slow down and explain it pretty carefully. You can see the definition of the statistic there in the little graphic on the top of the slide. So this one is based on the difference in the time from report date to the time for investigation start date. So those are 2 discrete data variables that we get in the NAMRS file. But if you look on the far left side of the graph, you'll see a bunch of programs with zeros, and those are programs that don't in their NAMRS file have a distinction between case initiation between investigation start date and report date. For all of the remaining programs, you see that overall that we have an average of 1.0, And then on the far right side of the graph, you will see that we have a number of programs that are considerably higher than that, going as high as 4.1 days. And so that's the description of what the numbers look like for case initiation across the states. So then, as Gila said, we looked at relationships with case characteristics and also with some policy and practice variables. And now I want to touch on a few of those highlights. So next slide. First one I want to talk about for case initiation duration is related to who the eligible population is. And so there are 18 APS programs that require older adults to have a disability to be eligible for APS. And then there's 9 programs that say basically anyone over the age of 60 or over the age of 65 is eligible for APS. And what we discovered was that there was a pretty big difference in those two different sets of programs. If older adults are required to have a disability to be eligible for APS, it's 1.8 days to initiate a case compared to 0.6 days. Why that is, I have no idea, but it is kind of interesting and something to think about if you fall into one of those two categories. So next thing that we looked at, next slide, was, and this is one that you're going to see repeated over and over, was does the state have a policy that says an investigation has to be completed within 60 days? Different states have different policy timeframes. Some states have no policy timeframes. But from looking at the data, we chose 60 kind of as our cutoff point. And so we had 3 states that doesn't require an investigation to be completed within 60 days, and 22 states that requires an investigation to be completed within 60 days. And you can see there's a pretty big difference in case initiation times. The states that don't have a policy take longer to initiate cases than the states that do have a policy. And we'll come back to this particular policy variable in subsequent durations as well. So next slide, continuing on with case duration. The next thing that we looked at, and again, this is a statistic or a policy variable we're going to look at across durations, is how does the state operate? Do they take intakes at the state level only, or do they take intakes at the local level? And in the case of 3 states, they take intakes at both the state and local level. And so for case initiation, we were curious, how is that related to or associated with the amount of time for case duration? And what we discovered was that at the local level, if they're taking intakes at the local level, then they take 2.4 days compared to 1 day if they are taking intakes at the state level. And so we find this kind of interesting, and so we're going to talk about it a little bit more when we get to the end. So state versus local is going to be one of our themes that we talk about today. So next slide. Continuing with the theme, this is a variable that says who is in doing the investigation. Is it a state administered APS system, or is it a locally administered APS system? The way we define that in our policy variable is, are they state employees or are they local or non-government employees conducting investigations? And what's the relationship between that and case initiation? And so what you will see is that state employees are doing case initiations on average in 1 day, and local and non-government employees are doing them in 2 days. So the question is, does this kind of trend continue as we look at some of the other durations? Does state versus local make a difference in them? And we shall see. Next slide. So finally, we looked at the issue of remote work. And remember, the time frame for this was back in 2021 in terms of remote work policies, that we realize states have probably expanded remote work policy since then, post-pandemic. And so what we asked back then was a series of questions about how you support remote work, or do you not support remote work. Most states said that they supported some sort of remote work, and those states that supported remote work had shorter case initiation times compared to those states that did not support remote work. And so those are the policy and case characteristic variables that we thought were interesting for case initiation. We will, like I said, discuss a couple of these issues at the end of our time today. So let's go to the next slide and talk about how long it takes to conduct an investigation. And the two NAMRS variables here are investigation start date and investigation disposition date. You see no zeros to the far left, meaning everybody reports those two dates, not surprisingly. And on average, it takes 47.7 days to investigate a case with the data the way that we looked at it. You see quite the range, from 15.5 days to 103.6 days. Okay, well then the question is, what types of case characteristics and policy or practice variables were associated with those higher or lower ranges? And so let's go to the next slide. And so the first one we looked at is this one we talked about with case initiation, having to do with whether an investigation has to be completed within 60 days or not. And this is not really a surprise for the 22 states that have a requirement to conduct an investigation within 60 days. They have a much shorter time frame for conducting investigations on average than the states that don't. 44.7 compared to 70.2. So next slide, please. And then we looked at the issue of post-disposition duration. So post-disposition duration sounds a little odd. What that is the difference between the investigation disposition date and the case closure date. And so why would there be a difference between investigation disposition and case closure? There could be any number of reasons. Probably the primary reason in a lot of states is if you are providing some sort of case management services, or you're monitoring the client after the investigation is concluded for any reason, then you're going to have a longer time frame before you do case closure. You can see from the zeros there, though, there are a number of states that don't make this particular distinction. The overall average was 7.3, and you can see for one APS program, it lasted as long as 35.17 days. So next slide to look at some of the characteristics that were associated with this. The first one we looked at for, I guess, fairly obvious reasons was case closure reason. And in NAMRS, there is a data variable that says, did you investigate the case only and close it, or did you investigate the case and provide services? There are a number of other variables to go with that, but those are the two that are primarily chosen. And so, not surprisingly, if you investigated the case and provided services, which is in 17 states, you have a longer post-disposition date than if you only investigated the case. So you've got 17 days compared to 9.5 days. But what that does say is that states keep cases open even if they're not providing services for a period of time after the disposition date, on average of about 10 days. So next slide. The next thing we looked at was our policy variable related to the 60 days to conduct an investigation or not. And so what we discovered here was that states that require an investigation completion within 60 days are associated with a much shorter time frame than those states that do not. And so that is an interesting how this impact of this policy rolls through all of these different types of durations that we are looking at. So next slide, please. And then finally, taking all of those durations together, case initiation time, the length of the investigation, the post-disposition time frame, and putting it all together and looking at overall case closure date, what do those time frames look like and what kind of variables are associated with it? And so you see on average that there is 57.7 days for overall case closure timeframes. And again, just like you see with investigation, and from a mathematical perspective, investigation is going to probably drive this number more than the other types of durations. You see a very wide range going from 24.6 for a overall case duration in one state, all the way up to 112 in the state with the longest overall case duration. Most programs, it should be said, fall in the middle there, but we do have a few outliers. So what's associated with overall case duration? Next slide. We looked again at this question of whether state employees conduct investigations versus local or non-government employees conducting investigations. And what we found was that state employees take longer to conduct investigations than local or non-government employees. This was kind of interesting to us, so we'll have some further thoughts on this one in a minute. So next slide, please. Since the part of what is driving overall case durations is whether somebody is receiving services or not. One of the variables that we had from our practice survey that we looked at related to this was whether the state had some sort of formalized service planning process. And 11 states indicated in that practice survey that they did not have a formal service planning process, and their durations were longer than the states that did have a formal service planning process. And so that is something to consider or think about in terms of your own practice. So next slide. Last thing is circling back to this question of remote work. And what we discovered was that if a state is supporting remote work, it is taking longer to investigate a case at 59 days compared to 48 days. Honestly, this one surprised us a little bit. And we have some thoughts, though, on why that may be, and we'll talk about that in just a second. So next slide, please. All right, so we are gonna, as I have been promising, have a discussion about why we think some of this is happening. You know, it wouldn't be a statistics presentation without you saying correlation is not causation. In any of these relationship statistics that we've been talking about, you know, remote work is not necessarily causing something, but is associated with something. And so that's something to keep in mind as we have this discussion. And I think the other thing to keep in mind is that, and it's kind of the spirit of what we are trying to do here, as I have often said when we've talked about data and using data in APS, data doesn't always answer all of our questions, but it sure gives us some interesting questions to ponder or to think about or to try to process and understand by looking at other data or from some sort of qualitative process to help us better understand our programs and improve our programs. And so it's in that spirit that we're going to talk about a few of these things that we have discovered along the way. And so I am going to ask members of the APS TARC team to pop back up on screen, and let's talk about a few of these things. So next slide, please. So the first one we wanted to talk about was case initiation time by intake model. Recall from the previous discussion that if a state is taking in intakes at the state level, they have lower case initiation times than if they're taking them in at the local level or if they're taking them in at the state and the local level. The question is, why do we think this is important? Or why is this something we should think about? Who would like to talk about this first?
Sure, I can start, Carl. For those of you that don't know me, I'm Michelle Gayette, and I came from the state of North Dakota, and we just implemented centralized intake within the last 10 years. And what I found was that it took a little bit of the burden off the regional staff, and it also decreased how long it took for an intake to actually come into the system. So there was faster intake at a central intake location, plus it was consistent in how we gathered the information and the questions that were asked, but it was also faster to get the reports out to the staff in the region because we weren't relying on one person to take all of those reports while also doing a second job of doing the investigations. I also found that having training helped, right? Consistent training, consistent supervision of an intake staff, and that training piece of how to gather the information and how to ask questions to get the information that you need.
So centralization resulted in some specialization that helped make the process more efficient.
Correct. We created a form to better gather information at the time of intake to help the investigations as well.
Anybody else have comments or thoughts on that?
I can add a little bit of insight, if that's okay. So like Michelle, I'm Jennifer Kirchen with the APS TARC, by the way. I came from the state of Minnesota and then later was the program director for Arizona. So I have directorships in 2 states. And I think that from my perspective, both of those states had centralization. So one local, one state. And in Minnesota, with the local administration, we noticed a lack of consistency or standardization at the local level. So all the counties were taking reports individually. There wasn't a standardized way of documenting whatever they were doing in their investigation. There wasn't a standardized way supervisors were guiding cases. But when we went to a more centralized model and had a contract where those reports were being taken, that centralized model, like Michelle said, had consistent training, they had consistent documentation, they had, just specialized positions of people taking reports, and that was their only job. And they had supervisors that was their only job, maintaining that, intake area. And conversely, Arizona was very, very much like what Minnesota went to with that centralized model, where there were intake staff that were dedicated to take reports. There were supervisors that were available while they were on the floor. So if there was a question, it could be answered in real time. With a decentralized model or a local level model, that report might come in, depending on how large that local model is. The report might go to a voicemail and the worker might call them back because, like Michelle said, if the person is taking reports and investigating, you have to balance. You don't necessarily investigate while you're in the office. So you've got that time period where maybe the report is coming in when you're out in the field. So that would create some delays in a decentralized model.
So Andy and Leslie, you are both in Ohio, which is a decentralized model. Do y'all have any particular thoughts on this one?
I do. Leslie, if you don't care if I go
ahead.
first.
Oh, wow.
I was going to say exactly what's already been said, really, that when you have dedicated intake staff, things are maybe processed a little bit quicker because they've had training and they specialize in that sort of thing. But it makes me think of the small counties that I have worked with in rural areas, even outside of Ohio, where you may have one person working in adult protective services. There's one person doing everything, and they may even work outside of adult protective services also. So it could be beyond just APS. And if that one person is doing everything and they have a really crazy day in the field, they're not going to be able to come back and process new intakes in a really timely manner. And, I would venture to say, and it's been an interesting statistic to look up, that the majority of our counties in the U.S. are probably rural. So I think that, when you have a rural county and one person, it's really going to be difficult.
I think to your point too, when there's less of a burden on the one staff, you might see more consistency too. And I know this is not what we're talking about, but in the reports that go forward for investigation,
Yep.
right? There's a little bit less of, I think this is less important than others. So I think there's some consistency that way too.
Yeah, they might use tools, for instance. So there is that
Correct.
dedicated consistency because they're all operating with the same tool.
So
Leslie, any final thoughts?
yes, when we talked about this, when you were doing the brief, I told you this one kind of surprised me. Coming from a state supervised county administered system, I would have thought the location for local systems would make it faster initiation times. So that surprised me. But I will say, and I mentioned earlier about the idea of effective resource management. In a local system like Ohio, we have many counties who depend on local funding. So the standardization that would have come from a centralized model could sometimes be difficult for some counties because they needed to control their front door. They had to be not just responsive to what their the definition of, the criteria for accepting a report, what makes a report. They had to be responsive to that state level definition of that, but they also had to ensure they were responsive to their community's expectations, because for a lot of them, that's where their funding sources were. And so centralized intake, the idea of it, anytime that came up in discussion, there was always pushback from local directors who wanted to control their front door. So I think all the points being made by my team members are valid. That makes a lot of sense about the standardization, but for a lot of local systems, I can see the standardization could also be somewhat problematic for them.
Yep. Those are great points. So let's go to the next thing that we wanted to talk about. And this was this whole discussion about state versus locally administered systems, which we kind of already touched on in the discussion that we were just having. And so we had this oddity in the data, at least it seemed a little odd to me, in which state administered programs have much shorter case initiation durations. So they're starting cases faster, but they're taking longer to complete them. And so I know when we were doing our focus groups on the workload tool a while back, those states that we were talking to that had pretty sophisticated workload management systems all said it's important to initiate cases quickly if you want to get a handle on your caseloads. Therefore, you get a handle on doing your investigations faster. Well, this data seems to sort of contradict that. In a way. Again, correlation's not causation. So what do y'all think is going on here? Who would like to take a shot at this one first? Get us started.
I can go first. So we've already kind of talked about the shorter case initiation, but I think that the longer investigation, to me, like I'm coming from a background of huge states, right? So if you have a centralized intake model, they're sending the reports out to the local level or the regional level or however your state is organized to do the investigation. And I think coming from huge states, the travel time for me is a huge deal. Both states that I have worked in have huge rural areas, and sometimes those rural areas are especially difficult to navigate. Everybody knows Minnesota, it's cold and windy, and with the 4 seasons comes snow and sleet and ice and wind and tornadoes and all kinds of things. So I think that the travel time is a big factor in that. And then I also think that when you're good at doing the case initiation, that means more reports are going out to the field faster for investigation. And there are limits to staffing, right? So when you have a program where, a county might have one, as some of the other SMEs have indicated, one staff, if the reports are coming in and you've got 1 or 2 or however many staff, documentation gets to be a barrier almost, where you're getting out and meeting that case initiation time frame, but your documentation might be pushed off to the side. And so when the case is open longer and longer, you almost have to refresh like what you actually did when you initiated the case, when you went out and did your first visit. So I think that it's kind of a perfect storm where if things are coming in so fast, you're good at one aspect, but you might not be as good at processing it later down the line.
Other thoughts,
think-
Leslie?
oh,
Go
sorry,
I
ahead.
want to piggyback on something Jen just said with the traveling and getting it done, because the priority of the work is client safety, right? So your initiation is where you make that determination. You get your case, you go out, you assess safety, you assess immediate threats and risk of maltreatment and those kinds of things. If you have a case that you have to block out a lot of time for because of the distance to travel, or it's not a safety situation where it's a high risk case where you have to, deal with urgent and emergent service needs and protection issues, those cases get pushed further and further back, I think, on your workload when you have intakes coming in and other cases where you need to go out now and assess safety first, because that is the priority of the program.
I think too, to
Yeah.
piggyback off both of you and kind of expand a little bit, is also I feel sometimes that we're often the only people that know about a situation. And if you're working in a rural or frontier area, there may be resource deficits. And a lot of our staff, they're so dedicated, they want to stay involved until that situation is remedied or there's some resources brought in to help remedy some of the issues that they found when they went out and did that initial visit. And I think coming from North Dakota, I saw that a lot, where the case durations extended because they were waiting for other services to come in to assist that person, and just kind of helping to keep them going, to keep them as safe as possible until those things could be arranged.
Andy,
I
any
think
thoughts? And I got a follow-up question.
Yeah, nothing major that hasn't already been said, but I think about it in terms of if you're working on a regional basis and you've got 3 counties, which may include some more suburban, rural, maybe even some urban areas, and the resources are going to be so different. Having to know what all the resources are in, on a regional basis versus just a county basis is trickier. And having to deal with all those, and it probably takes a little more time. So be interesting to see if there's other, we could compare all kinds of characteristics to this, but if there's anything else that factors into why it's a little bit longer for state employees, if there's some other factor that correlates to that, maybe something we can do in the future, the APS TARC.
So y'all tell me if you think any of these make sense. At the local level, the county-based employees have fewer resources and therefore they are much more motivated to get cases closed quickly. Yes or no?
I don't know that I would say, I think I would say no. I would say they have inconsistent resources. Like it varies from one county to the next, or from one location to the next.
I think they have better partnerships though. Like Andy said,
They do.
like when you're in a smaller area, who does what in that area. Sometimes you turn around in your seat and you say, hey, can you help me with X thing?
Right.
But I do think that sometimes you're waiting on a partner to do something. So, you're making that referral and you don't want to close out a case because you're waiting for that referral, even though you know the person that you're making the referral to.
Yeah, that was going to be the part B of my question is the conversely, does having the partnerships make it easier sometimes perhaps to get some cases processed? All right, so let me ask another question. And I just thought of this. So, and see if y'all agree or disagree. States have much more policies and procedures and documentation requirements to follow, and it just makes it that much harder to get cases closed. Yes or no?
I would say no to that one too. I think having worked in a county-based program, but having had a lot of exposure to state-based programs, it wasn't much it's not much different. I don't think the difference is very much. What you have to do and what you have to follow is pretty similar to the point where I don't know if it makes much of a difference, but I'd like to hear what other people think.
I'm going to disagree, actually. I think that coming from a county-based system, because you know everybody, because you know the resources, sometimes you do things that aren't necessarily prescriptive. You don't have a policy. It's just you do it because you know that it needs to be done. Where at a state level, I think that there are more policies and it is more prescriptive that you follow a certain pattern in the way you do things.
Michelle or Leslie, any thoughts on that one?
I'm leaning to no, because having been a policy administrator for a local administered system, we considered our policies to be minimum standards, and the counties then would have other requirements that they put on top of those. So I would have thought local agencies had more policy and more requirements than the state did.
Yeah. And so, I recall I did a ride along in Illinois, and I can distinctly remember the worker telling me about the local policies and the state policies. So she had to follow both, and so maybe. But I thought it was worthy of a little bit of discussion. All right, let's go to the next one, and so this is maybe the thing that surprised me the most in what we looked at. And just a reminder, this is pre-pandemic in terms of when we collected the policy data. And the question is, why do you think states that support remote casework have faster case initiation times, but longer investigation and case duration times than those that did not support remote work? It's, I come from a state, Texas, where remote work was considered absolutely necessary to being as efficient as possible. And so finding that those states have longer investigation times or longer case duration times was a little bit surprising to me. Not surprised that they initiate cases faster. What do y'all think? Who wants to address this one first?
I can go first on this one. This one's a little tricky because I think with initiation, it's evident to me what the answer is, but I don't know about duration. So with initiation, I think you have workers who are remote and will get assigned cases that are much closer to them than they would be to the office. So if you have a regional office and it covers 5 counties, you have somebody in an outlying county that works there, they can get there in 30 minutes maybe, as opposed to an hour and a half. So I think when you have remote workers, you can give them cases that are closer to them and save money on mileage, travel costs too. I would imagine it makes a lot of sense that you would initiate cases quicker, in my opinion. With the case duration thing, this is the one that confounds me a little bit, which I think you alluded to, Carl, earlier when you were initially talking about this data. The only answer I can think of to this one is that, and you hear a lot now about people returning to the office in the workforce in general post-pandemic so that they can collaborate better, so that they're in the office at the same time. There's more informal collaboration, talking about cases. You may, just ask your coworker who's not doing anything, let me talk to you about this case and tell me what you think about it. So, it may be that if you don't have remote work and you're in the office together, you can collaborate a little bit more and it's a little bit easier versus setting up specific times to collaborate and get together and talk about things, and only having maybe more formal opportunities to collaborate. So that second one's a little bit tricky. I'd like to hear what other people think about these.
Yeah, I don't think you completely convinced me. Anybody else got
I
thoughts?
don't know if I convinced
Do
myself.
you think, Andy, to take a little bit off of yours, that maybe there's that supervision piece too, when you all worked in one central location in a region, like with North Dakota, I could see what my staff were doing, but when you have remote staff, which I did the entire time, they were maybe not located remotely, but they were at offices not in my office building. It was harder to supervise staff that were working in a location other than where I was. And maybe that's part of it too. And then to take off from Jen's answer at one of the last questions, right? That piece of, you may have one person covering a region or several counties, and then that it's harder to get your documentation, and then it compounds and it's a snowball effect where you get behind, and the behinder you are, the more behind you get, right? So I think there's part of that too. Maybe that's my thinking.
I'm going to combine the two answers, actually.
Ooh.
I think that office location by far, I think, is a factor in faster case initiation with remote work, and the staff being closer to the actual work and the actual victims so that they can respond quicker. But the supervision, I think, could be a factor in managing the work. So, Carl, you talked about the workload tool, and I was kind of knee deep in all of that. And I think that supervisors play such an important role in getting the work done. So, initiating the work is one thing, but actually closing the case and making sure that all the I's are dotted and the T's crossed. If you have inconsistent supervision, you might have case duration times that spill over because there isn't that kind of regimented process.
That's
Leslie, any thoughts?
100% where my brain went when Andy threw out the word formal. That really resonated for me, because I believe that when I did direct service supervision, those impromptu ad hoc conversations that you had after somebody came back from a court hearing or back from a home visit or whatever, it's different than saving everything for those formal scheduled supervision conferences. And I do think that those very fresh conversations that happened in real time did a lot to help move cases forward, rather than waiting and bringing questions and saying, oh, okay, yeah, I'll do that now. Because that could have been, a week later, after it could have been done a week earlier if it had been something in the hallway, or like I said, just by somebody popping their head in your office door. So I do think the remote supervision versus the in-person supervision could make a huge difference.
Yeah, I mean, think about it. As you're coming back as an investigator, you're walking by your supervisor's office, your supervisor's saying,
Exactly.
hey, how'd it go? You don't have that with remote work.
Exactly.
So has the nature and changing tools to support remote work help, or can it help to overcome some of that?
I think so.
I think
I
you
mean,
could.
I mean, Slack discussions,
Yeah.
Teams discussions.
I think so. And just drawing on not my APS experience, but my experience as someone who has worked from home since 2011, things have gotten much more collaborative. I mean, we're all talking amongst ourselves right now from different states, and we talk to each other all day long. So I do think that, as time goes on, it gets easier and easier to do, to still have remote work and be able to collaborate more, for sure.
All right. Well, Andy used the word co-founding earlier. I think one of the things this whole discussion suggests to us is maybe Gila and I need to dig back into the data and look at what the co-founding variables might be in some of these cases. If you have thoughts on co-founding variables or anything else, here is how to contact us and all of our resources that are available. And we thank you for tuning into this webinar, and we look forward to talking to you next time.
Just very quickly, again, this webinar is recorded, so an announcement will go out, and to everyone when it is posted online for viewing. So you're obviously seeing it now if you're watching it, and just feel free to reach out to us. We'd love to hear your questions about it.
Thank
Thanks
you.
so much.